Robert was 72 years old, standing in his kitchen making a sandwich when his left hand stopped working. Just stopped. The knife clattered to the counter. He tried to pick it up again and his hand wouldn't respond. His arm felt heavy, like it belonged to someone else. And then his face started drooping on the left side. Robert knew exactly what was happening. He was having a stroke. He was alone. His wife was at her book club. His phone was across the room on the charger. And in that moment, Robert did something that neurologists say saved his brain. Something so simple that it sounds almost too easy to matter, but it does matter. And what he did in the 3 minutes before his wife came home and called 911 is the difference between Robert walking out of the hospital 5 days later and Robert spending the rest of his life in a wheelchair. I'm Dr. Rayan. I'm an anesthesiologist, which means I manage patients through some of the most critical moments of their medical lives, and I've seen stroke patients in the operating room, in the ICU, in recovery. I've watched what happens when people do the right things immediately, and what happens when they don't. And today, I'm going to teach you the exact 3-minute technique that can limit stroke damage before the ambulance even arrives. Because every second matters in a stroke. Brain cells are dying, thousands of them, every minute. And what you do in those first critical minutes can determine whether you recover fully or lose function permanently. But before I tell you what Robert did, you need to understand what's actually happening inside your brain during a stroke. Because once you see the mechanics, the technique will make perfect sense. A stroke is a blocked artery in your brain, usually a blood clot. It gets lodged in one of the vessels supplying oxygen to your brain tissue. And the moment that vessel is blocked, the brain cells downstream from that blockage stop receiving oxygen. And without oxygen, brain cells start dying within minutes, not hours, minutes. Here's the terrifying math. In a typical stroke, nearly 2 million brain cells die every minute the blockage remains. 2 million per minute. After just 3 minutes, you've lost 6 million neurons. After 10 minutes, 20 million. These cells control movement, speech, memory, sensation, and once they're dead, they don't regenerate. The damage is permanent. But here's what most people don't know. During a stroke, there are 2 zones of damage. There's the core, where blood flow is completely cut off and cells die immediately. And then there's the penumbra, the surrounding area, where blood flow is reduced but not completely stopped. Cells in the penumbra are struggling. They're oxygen starved. They're on the edge of death, but they're not dead yet. And this is where the 3-minute technique comes in, because if you can increase blood flow to that penumbra, even slightly, even temporarily, you can keep those struggling cells alive long enough for medical help to arrive. You can shrink the total damage. You can mean the difference between losing your ability to speak and keeping it, between paralysis and recovery. Now, you're probably wondering what Robert did standing in that kitchen with a useless arm and a drooping face. And I'm going to tell you, but first, you need to know the one thing most people do wrong that makes stroke damage worse. When most people realize they're having a stroke, panic sets in, heart rate skyrockets, breathing becomes rapid and shallow, blood pressure spikes from the stress. And ironically, this panic response makes the stroke worse. Here's why. When you panic, your body goes into fight or flight mode. Blood gets shunted away from your brain and into your muscles. Your blood pressure becomes erratic. The oxygen that is reaching your brain gets used up faster because your heart and lungs are working overtime. You're literally starving your brain of the oxygen it desperately needs during the most critical minutes. And there's something else. Many stroke patients in their panic try to get up and move. They try to get to the phone, to the door, to find help, and the physical exertion drains oxygen even faster. I've had patients tell me they tried to walk to a neighbor's house during a stroke and collapsed halfway there. The exertion accelerated the damage. So, the first part of the technique is counterintuitive. You need to calm down, not because staying calm will magically fix the stroke, but because panic makes everything worse. And there's a specific way to force your body into calm, even when your brain is screaming that you're dying. Step 1. He sat down immediately, not in a regular chair, on the floor. He lowered himself to the kitchen floor as controlled as he could, and sat with his back against the cabinet. Why? Because sitting or lying down immediately stops the physical exertion that's draining oxygen. Your brain doesn't have to compete with your leg muscles for blood flow anymore. And critically, lowering your head closer to the level of your heart makes it easier for blood to reach your brain against gravity. When you're standing during a stroke, your heart has to pump blood upward to your brain. That's hard work, especially when blood pressure is unstable from the stroke itself. But when you're sitting or lying down, the heart doesn't have to fight gravity as hard. Blood flow to the brain improves. Robert sat down. And that was step 1. Step 2. He controlled his breathing. This is the part that sounds too simple to work, but the science is solid. Robert started breathing slowly and deeply. In through his nose for 4 counts, hold for 2, out through his mouth for 6 counts. Slow, deliberate, controlled breathing. Here's why this matters. When you're having a stroke, your instinct is to hyperventilate. Rapid, shallow breathing. But hyperventilating actually reduces blood flow to your brain. When you breathe too fast, you exhale too much carbon dioxide. Your blood vessels constrict in response. Less blood reaches your brain. You're making the oxygen shortage worse. But slow, deep breathing does the opposite. It keeps carbon dioxide at normal levels. Blood vessels stay dilated. Blood flow to the brain is optimized. And critically, slow breathing activates your parasympathetic nervous system, the part that calms your body down. Heart rate stabilizes, blood pressure moderates, your body stops wasting oxygen on panic. Robert sat on the floor breathing slowly for 2 minutes, just breathing, and while he did that, his brain was getting slightly more oxygen than it would have if he'd been standing and panicking. Those struggling brain cells in the penumbra were staying alive. But he did one more thing, and this is the part that neurologists specifically recommend, but almost nobody knows about. Step 3. He turned his head to the affected side. Robert's left side was weak, so he gently turned his head to the left and tilted it slightly down. Why would he do that? Because blood flow to your brain isn't perfectly symmetrical. When you turn your head to one side, the carotid artery on that side opens up slightly. The vertebral arteries which run up through your neck can also be affected by head position. By turning his head toward the affected side, Robert was trying to maximize blood flow to the area of his brain that was being damaged by the stroke. Is this a cure? No. Is this going to reverse the stroke? Absolutely not. But is it going to potentially preserve a few thousand extra brain cells by optimizing blood flow for those critical minutes before help arrives? Yes. And those few thousand cells might be the difference between needing months of speech therapy and speaking normally, between a wheelchair and walking. Robert sat on the floor breathing slowly, head turned to the left for 3 minutes, until his wife came home and found him. She called 911. The paramedics arrived within 8 minutes. Robert was rushed to the hospital and received clot-busting medication within the critical window. And he walked out of the hospital 5 days later with minimal deficits. Now, would he have recovered anyway? Maybe. But every neurologist I've spoken to agrees that what he did gave him better odds. And when brain cells are dying by the millions, better odds matter. Now let me tell you what else you need to do the moment you realize you're having a stroke. If you're alone and you're having a stroke, you need to get to a phone. But here's the critical part. Don't stand up and walk across the room. If you have to move, crawl. Stay low. Minimize exertion. Every step you take standing up is oxygen your brain isn't getting. If you can reach a phone from where you are, do it. If you can't and you have to move, crawl to it while staying as calm as possible. And when you call 911, say 4 specific words immediately. I am having a stroke. And when you call 911, say 4 specific words immediately. I am having a stroke. Don't say, I think I might be having a stroke. Don't say something's wrong with my arm. Say clearly and directly, I am having a stroke. This triggers the highest priority response. The dispatcher knows this is a time-critical emergency. They will get an ambulance to you faster than if you're vague about your symptoms. Then give your address. If you can't speak clearly because of the stroke, try to stay on the line. But getting those words out, I am having a stroke, and your address, those are the 2 critical pieces of information. And here's something else. If you're with someone who's having a stroke, do not let them talk you out of calling 911. I've had patients tell me they knew they were having a stroke but didn't want to bother anyone. They waited, they hoped it would pass, and by the time they finally got to the hospital, the window for clot-busting medication had closed. A stroke is a medical emergency, not a let's wait and see situation. Call immediately. Now, let me tell you about the treatment window. When you arrive at the hospital during a stroke, there's a medication called TPA, tissue plasminogen activator, that can dissolve the clot blocking your brain's blood vessel. It's incredibly effective. Studies show it can significantly reduce stroke disability if given in time. But here's the catch. It has to be given within 4.5 hours of stroke onset, preferably within 3 hours. After that window closes, the medication becomes too dangerous to use because the risk of bleeding in the brain outweighs the benefits. And even within that window, sooner is better. Data from the American Stroke Association shows that for every 15-minute delay in treatment, stroke patients lose an average of 1 month of disability-free life. 15 minutes equals 1 month. That's how critical time is. So when you do the 3-minute technique, sitting, controlled breathing, head positioning, you're not just preserving brain cells, you're keeping yourself stable enough to stay conscious, to call for help, to give the paramedics accurate information when they arrive. You're buying time for the treatment that can reverse stroke damage. But there's something else you need to know about strokes that affects people over 60 specifically. This information could help you prevent a stroke. Your risk of stroke doubles every decade after age 55. By the time you're 75, your stroke risk is 8 times higher than it was at 50. Why? Because the blood vessels in your brain age. They become stiffer, less flexible. Plaque builds up on the vessel walls, narrowing them. Your blood pressure tends to increase with age, putting more stress on these aging vessels, and conditions like atrial fibrillation become much more common after 60. If you have high blood pressure, if you have atrial fibrillation, if you have diabetes, if you smoke, your risk is even higher. These aren't abstract statistics. These are real risk factors affecting real people. And here's what frustrates me. Many strokes are preventable. Blood pressure medication works. Blood thinners for atrial fibrillation work. Controlling diabetes works. But people don't take their medications consistently. They skip doses. They stop taking them because they feel fine. Let me tell you something I tell my own parents. Feeling fine doesn't mean you are fine. High blood pressure doesn't hurt. Atrial fibrillation often has no symptoms. Diabetes can be silent for years. You feel fine right up until the moment you have a stroke, and then fine is over. If your doctor prescribed blood pressure medication, take it every day. If you're on a blood thinner, take it exactly as directed. These medications are preventing the stroke you don't know is coming, and I would rather you take a pill every day for 30 years than spend 1 day unable to speak or move. Now let me tell you what happens in the minutes and hours after you get to the hospital. When you arrive at the hospital with stroke symptoms, you're going straight to a CT scan. The doctors need to see your brain immediately to determine what type of stroke you're having. Is it ischemic or hemorrhagic? The treatment is completely different for each. If it's ischemic, which is about 87% of strokes, and you're within the treatment window, you're getting TPA. The medication goes into your IV, and within minutes, it starts dissolving the clot. Blood flow is restored. Brain cells that were starving for oxygen start recovering, but not all of them. The cells that died in the core are gone, but the cells in the penumbra can recover if blood flow is restored quickly. Now let me address something important. What if you wake up with stroke symptoms and you don't know when the stroke started? About 25% of strokes happen during sleep. You go to bed fine and wake up with weakness, slurred speech, facial droop. These are called wake-up strokes, and they present a problem because we don't know when the stroke started. You could be outside the treatment window, but there's new technology. Advanced MRI imaging can sometimes determine if brain tissue is still salvageable. Some patients with wake-up strokes are still eligible for clot-busting treatment based on these imaging findings. So even if you wake up with symptoms and you're not sure when they started, call 911 immediately. Don't assume you're too late for treatment. Let the hospital determine that. And while you're waiting for help, use the 3-minute technique. Sit or lie down. Control your breathing. Position your head toward the affected side. Give your brain every advantage you can. Now, I want to talk about something that's hard to hear, but critically important. What are the warning signs that a stroke might be coming? Some strokes happen without warning, but many, perhaps most, give you warning signs in the hours or days before. These are called transient ischemic attacks, or TIAs. They're mini strokes. The symptoms are identical to a stroke: weakness, facial droop, speech difficulty, vision problems, but they resolve within minutes to hours. A TIA is your brain's emergency alarm system. It's telling you that blood flow to part of your brain was temporarily blocked. The blockage cleared on its own, but it's a massive warning sign that a full stroke is coming soon. Statistics show that after a TIA, your risk of having a major stroke within 90 days is about 17%, nearly 1 in 5. If you have stroke-like symptoms that go away, you do not breathe a sigh of relief and ignore them. You call 911 or go to the emergency room immediately. A TIA is a medical emergency. Treatment after a TIA can prevent the major stroke that's coming. And here's what makes this so tragic. I've talked to stroke patients who tell me they had warning symptoms days before. Their arm went numb for 10 minutes and came back. They had slurred speech that resolved. They ignored it because it went away. And then the big stroke hit, and this time it didn't go away. Don't be that person. Know the signs. Face drooping, arm weakness, speech difficulty, vision changes, sudden severe headache, dizziness, and loss of balance. If you experience any of these, especially if you're over 60, get medical attention immediately, even if the symptoms resolve. Let me be very clear about something. The 3-minute technique is not a treatment for stroke. It's a way to preserve brain tissue and stay stable while you wait for real medical help. You still need 911. You still need the hospital. You still need clot-busting medication. Whatever intervention the doctors determine is appropriate. But in those critical minutes before the ambulance arrives, you have some control. You can sit down. You can control your breathing. You can position yourself to optimize blood flow. These simple actions can preserve brain function that would otherwise be lost. Here's what I want you to do. Right now, think about where you spend most of your time. Your kitchen, your living room, your bedroom. Where's the nearest place you could safely sit or lie down if you suddenly felt stroke symptoms? Where's your phone? Can you reach it from that position? If you live alone, keep your phone with you in your pocket, not charging across the room. Because if you can't reach the phone, the 3-minute technique doesn't matter. You need to be able to call for help and talk to your family. Make sure they know the stroke warning signs. Make sure they know to call 911 immediately. Not to wait and see if symptoms improve. Make sure they know not to let you talk them out of getting help. I've seen too many cases where a spouse had obvious stroke symptoms and the other spouse waited because the patient insisted they were fine. By the time they got to the hospital, the treatment window had closed. Don't let pride or embarrassment prevent you from getting life-saving treatment. And if you have risk factors, take them seriously. Take your medications. See your doctor regularly. Get your blood pressure checked. These boring routine things are what prevent the catastrophic emergency. Robert, the man I told you about at the beginning, takes his blood pressure medication now, every single day. He didn't before the stroke. Now he knows better, and he's lucky he got a second chance. Not everyone does. You now know what to do. Sit down immediately. Control your breathing. Position your head toward the affected side, and get help as fast as possible. These aren't complicated steps, but they could save your brain.